Welcome everyone to the paper presentation session on health and education. Ms. Mia Mikic will grace the session as a chair and Ms. Samahok Bidisha will grace the session as the discussant. The paper presenters of the session are Ms. Banantika Datta, Ms. R.M.M. Mayoshi, and Ms. Shonamani Kormakar. A few housekeeping rules to start the session. I'd like to request the chair discussant and the paper presenters to keep their video on. Participants are requested to mute their audio and turn off their video during the session. To make a comment or ask a question, use the chat box or use the raise hand option. Please mention to whom your question is directed to, followed by your name and designation. The chair may read out your question or ask you to deliver your remarks during the open discussion session. Over to you, Honorable Chair. Dr. Mia Mikic, are you here with us?
Mia, you have to unmute your microphone.
Yes, I'm trying to do that because I'm trying
now you're
to
audible.
see how it's going to work. Right. Okay. Very sorry for that. Happened in the most unfortunate moment. So the presenters were maybe announced already because I lost the connection, or shall I start the session from zero?
The name of the presenters has already been mentioned, so I think you
they were mentioned. Okay, very good. Okay, so thank you very much for that, and I really apologize. I hope I'm not going to be losing connection through the session. So I'm really privileged to be, to be chairing this session, not only because it is making up for some of the sole male panels that we saw in the previous 2 days, because today we have all women session, but because the topics are extremely important for the future of the regional cooperation, of course, in this post-pandemic world. The session is combining two large topics, two large concerns, health and education, and we will be exploring certain aspects of those through the papers. But let me just put it in a context of our current life. So COVID-19, of course, is a health crisis first and foremost, but it did result in socio-economic impacts of the first degree, or the degree that we haven't seen for a very long time. And sectors that were impacted through these are variable, and of course many are purely economic, but education is the one that really was impacted in both mostly negative, but also in some positive ways. And of course the health sector as well, or public health sector more specifically, went through the really changes in terms of mindset, not only of policymakers and public, but also analysts, in terms of how to approach future development of that sector, as well as an economic. I think in terms of cooperation and what we can do in both of these sectors, we should be guided, of course, with global solutions first and foremost, because these give us always the first order solutions, and balance the regional approaches with those global. In terms of the health, of course, we have COVAX and all other initiatives started with many countries under the WHO. And so the regional cooperation, we need to discuss how to fit into that. and hopefully we are not going to be following European example in that context. And in terms of the collaboration, in terms of the vaccine distribution, etc., although there are some other very good European examples that may be followed, there are also very good Asian examples, particularly with ASEAN strategic framework in terms of the cooperation for the public health emergencies. In education, I think it's very good to look at the impact of what COVID created in a longer term with respect to the creation of human capital and how we can actually make up for the losses in that context. And I think it will be really good to link to the 9 points of the International Commission on the futures of education, and look at these points in terms of, really treating education as rights, as a common good, and looking at how international solidarity and financing could actually enhance getting that get solutions to the education to really bring it to the last possible person that needs it. So there are these are the sort of a global coordinates that we can take, and it's very interesting to see how individual countries and of course BIMSTEC countries region will try to enhance its own cooperation in these areas, and will be guided with some points that are brought by the researchers here, and so we'll go in the order of how they are presented in the flyer. So we'll first deal with the health sector, and then we'll have 2 education papers, and then we'll hear from the discussant, and then we'll open for the floor to everyone else. So if I may ask for the first presenter, Ms. Datta, to present the health paper, please. Thank you. And I'll remove myself from the video so that I don't abstract. Okay. Please go ahead. And you are given only 10 minutes. I know this is very restrictive in terms of the depth of your research, so I suggest you focus really on the core points of what you have to say in your from your paper. Thank you.
Thank you so much. Am I audible?
Yes.
Okay.
Yes, you are.
Good morning, everyone. Thank you for giving me the opportunity to present the literature that I'm currently looking at. I recently started working in public health. So I'll just go in the need for cooperation for public health in the BIMSTEC countries. So this is a brief outline of the presentation. I will just briefly touch on the health status, the health facilities, the need for cooperation, and the current BIMSTEC initiatives in health, and briefly followed by some very basic recommendations. So as we know, the BIMSTEC was originally formed in 1997. It is an inter-regional cooperation connecting the SAARC and the ASEAN countries. It is comprising of one of the biggest, largest populous countries, second largest, of course, India. So it is bringing around 1.7 billion people together with a GDP of around 3 trillion USD as of 2020. So BIMSTEC initially signed on some priority sectors, which was further extended to 14 priority sectors that they decided to cooperate on, and public health is one of them. And COVID-19 especially, COVID-19 especially highlights the need and the role for further strengthening this cooperation in the health sector. As we all know, all the countries suffered great losses of lives, and it encouraged the need for public health services and doctors and nurses and more investment in the public sector. And the need for cooperation is already visible, like India giving vaccines to 6 neighboring countries. It is like the late January data. So out of which 4 were BIMSTEC countries, Bangladesh, Bhutan, Nepal, and Myanmar. I think some shipments have already gone to Sri Lanka as well. So briefly touching on the health status, from 1990s onwards, we have read in the literature time and again something of the phenomenon called as the South Asian enigma, where it was studied that the South Asian countries have very low very high prevalence of undernutrition among the children, and they had very poor quality of nutritional status among the young women. And in the recent times, the literature has shown that India, Bangladesh have sufficiently taken active steps to reduce the undernourishment rates, which was basically due to the parental education, due to government schemes in both the countries and several other low-income countries. Now, these countries in BIMSTEC are very similar because they all fall in the lower middle income range given the World Bank classification. So recently, Sri Lanka has also shifted from the upper middle income group to lower middle income group. So now all the countries in BIMSTEC are in the same income group. However, there is a wide disparity in the health indicators. However, for the paucity of time, I'm not showing all the health indicators. I have looked into a prevalence of anemia, prevalence of HIV, malaria, children health status, women health status, maternity status, etc. And so in the right side diagram, we see that there is a wide disparity in the health expenditure per capita for the BIMSTEC countries. So the recent data is also up till 2016 only. So we don't have recent data comparing all the countries from WHO as well. So we see that while Thailand was investing something around $950, India is investing only 267 per capita, whereas Bangladesh is investing only $88 per capita. So this shows the wide disparity in the health expenditure done by the government, and the post-COVID reactions. To give some very recent data, in the union budget presented in India just early February, 1st February, and so India has increased the health expenditure by around 130%, from 1.6% in 2019-20 to around 4% of the GDP in 2021. So this shows that the increasing focus and the drive towards the health sector. Now, to briefly touch on the healthcare facilities. Now, are we having enough doctors and nurses? This scarcity was severely felt during the COVID, when the doctors were doing several shifts continuous with the PPE kits on. So in the WHO data for 2006, it showed that the threshold was around 22.8 doctors per 10,000, while only India marginally fared better, and Sri Lanka and Thailand did better, while the other 4 countries did worse than the WHO threshold. In 2020, the threshold was increased to 45.6 per 1,000 population, and only Sri Lanka and Thailand were faring better, and India had also actually fallen below the threshold. So this shows that we have dearth of doctors and nurses in the country. Now, an even more stark and surprising fact that only 45% of the doctors have a medical education degree, as you can see in this table that given in a WHO report 2016. I have, however, cropped the table to fit in the slide. But if you see the whole table, it is more stark. It shows that around 30% of the doctors and nurses only have a secondary school education, which is like a 12th standard degree. They don't even have a graduation, like a graduate degree or a master's degree or a medical qualification. However, India is also the largest source of foreign doctors in the OECD. Like, we are sending a lot of doctors out. There is like a brain drain happening. And also the second largest source of nurses. While our home domestic conditions are not met and we are falling below the 45.6 per 10,000 population threshold, we are sending major chunk of our foreign doctors as foreign doctors, and like there is a lot of emigration happening from India to the developed countries. Now, why there's a need for cooperation? So I specifically look in services trade as major part of my interest. So services trade, it can be applied. As we know, there are 4 modes of services trade. I am not going into the details, but we can see that in health specifically there, and the mode 1 can be utilized in the form of telemedicines and teleconsultation, giving online video lectures in or helping in online surgery or something of that sort. And in mode 2, where the consumer actually moves to the supplier, like patients coming in for surgery or for other treatments, they do not often disclose medical reasons while they're traveling to India or Thailand for treatment. Why? Because it delays the visa process. You have to go through a lot of medical checkups, and because of which you later face post travel difficulties in transferring money, getting the required permissions, etc. And there is also a lot of thrust, which I will focus in the next slide, about setting up hospitals.
Presenter, you have 2 minutes left.
Sure. So there is a need for quality harmonization and standardization if you want to invest in FDI in a different country. Also, the mobility of professionals, language barriers is the main thing. I will also touch on this in the next slide. So this is the data I have collected from the EORA database Mario tables, where it is showing the exports of India's education and health services to the different countries' education and health services. So this is a sectoral countrywide database. So it shows that most of the trade that is happening within the interregion is very, 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 very less. Whereas most of the trade is with the European partners, only Nepal and Bhutan is trading with India, is the maximum share partner, whereas other countries are trading with other developed countries. In the BIMSTEC initiatives that I would like to talk, there are two major initiatives on traditional medicine and about the telemedicine. So traditional medicine is actually a very great initiative because we have a lot of Ayurveda and traditional medicine knowledge. And then the colleges, there was a proposal of setting up an university called as BATMU, and the colleges will be affiliated to that. So there can be cooperation in R&D, education, health of the training professionals, and integration of the health system incorporating all this in your national health system also. And in the BIMSTEC telemedicines is also where India leads the proposal. It is showing how quality standardization video sharing can also be an fruitful initiative. Basically, we need to harmonize the curricula and form a mutual recognition. So here are the recommendations, which shows that BIMSTEC can learn from ASEAN, where ASEAN has signed a lot of MRAs in nursing services, medical and dental practices. However, it shows that no physician or dentist has actually traveled under the provision. So however, we can also learn from the poor implementation and form better policy for coordination. What I was saying about the setting up of regional language centers is that Thailand requires the health professionals to obtain a medical degree in Thailand, which the final exam is conducted in Thai language only. So if an Indian who is not aware of the Thai language, it's very difficult for an Indian doctor to go and practice in Thailand in the first place. So there should be language centers, proper MOUs, harmonization of educational qualification. And just to conclude, I would just say that there should be more initiatives like the traditional medicine and telemedicine. BATMO is a good initiative. And India, especially Ayush, which is focusing on creating some health workers on Ayurveda and homeopathy, they should have special skills because they are the ones who are taking active efforts in reaching the rural corners of the country and uplifting the health status. And also more coordination is actually required, and more building more health infrastructure, increasing health expenditure, facilitate health mobility of professionals is other areas of concern that the policy should look into. Yeah, that's it. Thank you.
Thank you very much, Ms. Datta, and we will defer from commenting on the paper and your points until we hear from the discussant as well. I will now turn to the first of the education paper. Both of these are actually exciting because they provide some primary data collection as well. So let me turn to Ms. Mayoshi. I believe she will be presenting the next paper. Ms. Mayoshi, the floor is yours. You have next 10 minutes to present your paper. Please go ahead.
Thank you for giving me this opportunity, and good morning. Greeting to the chair of the session and discussion of the session. My name is R.M. Mayoshi. I'm pursuing PhD degree at Transylvania University of Brasov, Romania. I conducted this research with Professor S.V. Abhiratna from the Department of Economics and Statistics, University of Peradeniya, Sri Lanka. The topic is student perceptions of e-learning during the COVID-19 pandemic. So let's move to the introduction of the study. The COVID-19 pandemic is having a significant impact on higher education system in the world. Many countries around the world have temporary closed universities and have made all universities across the world adopt online teaching to prevent and protect their students and staff members from COVID-19 pandemic. So university education, university courses, examinations, and graduation ceremonies are conducted online because of the pandemic. Therefore, in the education system, media like Zoom and Moodle, emails, and video communication systems are having uh, significant impact on higher education system in this reason. At the end of third week of March in 2020, the government of Sri Lanka announced a nationwide lockdown. All education institutes, from preschool to universities, had been temporarily closed. The University Grant Commission has seen online education as the only and best solution for this crisis time and have shifted to online teaching as the most convenient way to face the COVID-19 pandemic. However, online teaching is quite curious for developing countries like Sri Lanka. The shift to emergency online teaching, it receives mixed reaction. Online teaching has its advantages and also disadvantages. In this study, we use original technology acceptance model is supposed by Davis in 1989 as the theory for the study. Objective of the research. So this study is very important to get an idea that whether student comfortable with e-learning or rather would want to go back to face-to-face learning. So the objective of the study is to determine the student perceptions of e-learning during the lockdown period due to COVID-19 pandemic. In order to address the research objective, following research questions are posted. What are the perceived usefulness of e-learning? What are the perceived ease of use e-learning? What are the attitudes of student towards e-learning? And what are the intention of student to use e-learning in the future? So let's move to the methodology. So this study was used online survey with a structured questionnaire that consists of 5 parts. Target population was arts faculty students, University of Peradeniya, Sri Lanka. University of Peradeniya is one of the leading and public university in Sri Lanka. Faculty of Art is the largest faculty among 9 faculties of University of Peradeniya with 3,614 undergraduates. So sampling technique, purposive sampling technique was used to avoid the problems with accessibility in the closer of the university. Sample size was 160 undergraduates. This research, as a research instrument, we used statistical software of SPS version 22. Descriptive analysis we use. The analysis use the basic frequency, percentage calculation, mean and compact alpha values. So let's move to the results and discussion. Table 1 represents the basic information of the sample. Out of 160 sample, 26.3% represent male students and 73.8% represent female students. The ratio is approximately match the gender balance of the student. Levels of study, first year 24.4%, second year 26.9%, third year 24.4%, final year 24.4%. So we check the previous experience. Majority of students do not have previous experience. It's 65.6%. Choice of equipment, majority of students use mobile phones for e-learning activities. To check the reliability of the question, we use comeback alpha value. Perceived usefulness of e-learning, we included 5 questions. Perceived ease of use e-learning, we included 2 questions. Attitudes of students towards e-learning, we included 2 questions. According to comeback alpha value, all values are greater than 0.7. It means the questions are reliable. Let's move on to the perceived usefulness of e-learning. We included 5 questions. According to the average value, the majority of students believe that e-learning is useful. So people can study from anywhere in the world, flexibility to study at the time convenient, technology is available to take tests and submit assignment electronically, interaction between instructor and students. So table 4 represents the perceived ease of use e-learning. To identify ease of use e-learning, we asked 2 questions. E-learning is user-friendly and easy to find information. According to the average value, 9.38% and 58.4% said e-learning is user-friendly and easy to find information. Furthermore, we asked the basic ease of use e-learning. They said attached file, chatting, downloading, and posting message are very easy to use e-learning. Table 6 represents the attitudes of students towards e-learning. So we check the attitudes of students towards e-learning using opinion of e-learning and how much you enjoy the e-learning during the COVID-19 pandemic and cost of e-learning. According to the opinion of e-learning, the average value represents e-learning is innovative concept and must be encouraged, and e-learning is fun to use. How much do you enjoy e-learning during the COVID-19 pandemic? The 20.7% of respondents indicated that extremely and very enjoyable. 19.4% responded indicated that extremely and very unenjoyable, and 60% said somewhat enjoyable. This is the figure 2 represent the cost of e-learning. 41.8% indicated that e-learning is more expensive than full classroom learning. And external factors also affect to intention to use e-learning in the future. So we got the ICT literacy as the external factor. 93% said have moderate ICT literacy. Figure 4 represents technical problems. 94% of the sample faced technical problems during the e-learning classes. So intention of student to use e-learning in the future. Intention of student to use e-learning in the future affected by the perceived to be useful during the useful of e-learning, and tools and e-learning platform and attitudes. So we asked, do you like to use e-learning in the future? 55.6% said they like to use e-learning in future. 16.9 undecided, and 27.5 say disagree with this. In conclusion, the result indicated that e-learning is perceived to be useful during the COVID-19 pandemic because it has some advantages. People can study from anywhere in the world, and flexibility is study at the time convenient. Technology is available to take tests and submit assignment, and interaction between instructor and student. E-learning platform and tools are perceived to be easy to use. E-learning platform is easy to find information and user-friendly. Attitudes towards users are the positive or negative feeling of the student towards e-learning that influence their intention to use e-learning in the future. E-learning is more expensive than fully classroom learning, and also students face technical problems during the e-learning. So it can reduce intention of students to use e-learning in the future. However, the majority of students accept online learning. Recommendation: in order to increase the perceptions of e-learning among university students, we suggest to introduce better internet plans and internet connections and data plans, etc. Recommendation for the future research: in future, researchers can enlarge the sample because we got the university faculty sample as the faculty of arts. However, we can expand the sample size. Thank you for listening.
Thank you very much, Ms. Mayoshi, for your presentation. Let us turn to the next paper. So I believe we have Ms. Karmakar to present the next one, which is dealing with the education in a case study in Karmakar. Are you with us? Yes. Okay, please go on. You have 10 minutes.
Thank you for giving me this platform. I'm extremely grateful here to get to all in one platform.
Ms. Karmakar, you have to be a bit louder, please.
Okay, can you hear me?
Yes, much better. Thank you.
Thank you. So my paper was about the education sector. So I have tried to phases the levels of the interviewees. I'm gonna. Can you see my screen?
Yes, your screen is visible, but would you like to
Yes.
start from the beginning? Yes, sure.
Yes.
Thank you.
So I am a student of, I'm pursuing my chartered accountancy degree in Institute of Chartered Accountants of Bangladesh, and I have my co-author Nazif with me. So the research is about the education sector and the impact. So we have a few research questions that how the higher secondary level students, we have set a few levels of students who are on whom we have surveyed, like how the higher secondary level students, graduating, postgraduate, and professional students have faced the challenges due to the pandemic. What is the impact of the challenges on the sector, and what the job sector wants from the upcoming workforce. Our goal in this paper was to explore the challenges and the impacts faced by mainly the students, and we tried to establish a correlation with the job sector demand by the recruiting organizations. So you know that 1.6 billion children across 191 countries have been severely impacted by the temporary closure. And up to mid-June 2020, COVID has essentially caused discontinuation of the regular academic curriculum of around 40 million students in Bangladesh. So it was a great, the students had suffered a great disastrous effect on their regular flow of study. In this study, the methodology, we have selected a very exploratory study, and it is of qualitative nature. So we have set the research questions and analyzed through the survey questionnaire. And here, as you can see, that there are 5 research questionnaire that was created by us, and we have given it to the students. If we go to one question, you can see that how it was conducted. So it is a questionnaire of the students in higher secondary level. We asked them that where they are from and how was their experience regarding the educational life, and if they have participated in online classes, and whether they think that the classes were effective, and how actually they are expecting to build their career in future, given that they have suffered a lot and they might think to revise their career plans in future, and what they are actually apprehending for the future. This how we have surveyed the students of different levels and came to a conclusion that consists of some observations. We are going to talk about the study findings now. At the higher secondary students who have faced autopass, you know that after 1971, this is for the first time that the country has gone through a phenomenon like autopass. This is a very unusual thing that happened after so long. What autopass is, you know, that the student will be assessed based on their homeworks or home studies, but they won't be they won't be assessed in terms of their regular types of examinations. This is a very unusual situation, and we try to, and it is a concern. So we try to actually explore how they're thinking about this. So you can say that see that 100% of students say that the educational experience during the pandemic was not satisfactory at the normal pace of their study was hampered. They have reported mental instability, anxiety, sense of uncertainty during the lockdown. A portion of them had reported that though it was not regular flow, but they could learn from internet, and 75% of them attended online classes, and 87.5% said that they were effective. 75% have said that autopass will be unfavorable to their career as they will face problems to get admission in universities, and a portion of them think that recruiter won't employ them as they might find them unsuitable or underqualified. It is fear for them. They're actually suspecting uncertainty to join the workforce. And around 40% of them see silver lining, that something you can happen. So let's go to the graduating and postgraduating students. They're mainly from the leading public universities and private universities from Dhaka city. They're every one of them are waiting to join the job sector. 50% of them are willing to go for higher studies, and most of them had unsatisfactory experience during the pandemic. 75% of them attended the online classes, and many of them revised their career plan as they saw companies cut their cost by laying off employees in desired job for other reasons. This is very important, that companies have gone through many cost cutting and laying offs and retrenchment. So they have most of them have revised their career plan actually due to this. Some of them were waiting to directly go to job sector after graduation, but as COVID actually arrived, they joined to attend post-graduation to subsidize or minimize the delay where it was possible to subsidize the delay. It was observed from the respondent that they are concerned about the fact that many private organizations came to a standstill and people became jobless, and they were very concerned about that. And it was their thinking that many of them think that knowledge in technological fields is very essential. Study findings of the professional study. As being a professional student, I belong to the professional realm, and it is different from the regular students. Like the samples were collected from the Chartered Accountancy article students of a CA firm in Bangladesh. The CA students or the professional students they study along with their work. So they have seen a change in the pattern of the work. Many of them were off track and anxious and developed.
Presenter, you have 2 minutes left.
About the upcoming days, some of them had a bad result on examinations. This was one of the study findings, that they were indulged into so much anxiety and in procrastination. They had developed a sense of uncertainty for the future, that whether they will be able to appear in the examinations. For 1 year, many professional examinations were not held. So it actually, for most of them, it actually impacted on their results. Who have attended the online classes, many have welcomed the paradigm shift due to the technological advancement that they could actually work from home. A few of them had developed entrepreneurial ideas. This is very important, that they have actually developed on entrepreneurial ideas. Others were, and some of them were actually formed to their previous plan. So on the other hand, some joined the professional studies to compensate the delay, as it was seen for the graduating and postgraduate students. They assume that the job sector will require proficient people in the technology. So we have also interviewed the recruiters, and recruiters were from banking industry and R&D sectors of Bangladesh. They said that their business expansion was reportedly hampered. Their bottom line was badly affected. Many of them directly did not lay off the employees, but some NGOs that may need to curtail employee benefit in future. They are working on digitization of core banking systems and launching automated products. So they are looking for employees who are proficient in technological know-how and are comfortable with flexi time, work from home, etc. So this is a very important issue. So in conclusion, we can say that recruiters want to welcome the students who are willing to join the workforce, who are proficient in technological know-how, and they have actually reshaped their career planning. And the labor market, upcoming labor market, has a high demand of technological proficiency, and auto-pass is anticipated to be negatively related with admissions tests for higher secondary students. Thank you so much.
Thank you very much, Ms. Karmakar, for the presentation. So we will now hear from Professor Sayema, who will be, who has been given a very difficult hand in commenting on these three diverse papers. So Professor Sayema, please, the floor is yours.
Thank you so much, dear madam. First of all, let me tell that the papers that we have, one on health and two on education, the common thing is like all three papers, they have in fact talked about some very pertinent research questions, which are very important, especially when we are in the month of February in 2021. Now, the thing is like there are a lot of issues which we can take away from here as a policy suggestion. That is also very important. So this evidence-based policy making we have been talking about. So we have a lot of food for thought from that point of view. So I will just go through three of the papers very quickly, then I will have some general comments. First of all, the paper on health by Ms. Banatika Datta. That is in fact emphasizing on the need for cooperation in the BIMSTEC region, and I think it's a very excellent paper in terms of the research question that has been raised. Few points and few issues for the improvement of the paper and the presentation I can suggest. Like one is like when we are talking about health, I know there is a time constraint. So in the paper you can think about like focusing several aspects of the health. Like when we are talking about health status, there can be one issue related to health service delivery, health expenditure. There can be issues related to health outcomes. There can be issues related to nutritional aspects. So all these 3 or 4 pillars, I would say, these are extremely important. And I would say that if you can motivate the study while focusing on these three or 4 pillars, the way you want to organize, and then start with the country comparison within these 3 pillars, that would be more motivating and interesting. That would be more exciting. That is, I would say. I know there is a time constraint. That is one of the issues. Second point that I would like to emphasize is like the recommendation that you have made. Excellent recommendation, and some are very pertinent for the countries like Bangladesh. Few points is here is like one thing we must keep in mind that when we are talking about cooperation between the countries, across the countries, when for some countries we have already very low public spending in health, that should not be considered as an alternative, because we must first prioritize strengthening our public service delivery in health and provide sufficient resources for the budgetary allocation in health. From a country perspective, then we should think about the cooperation. So that should not be an alternative, but should be go side by side. So this is a point that you can come up in the recommendation. And the second point is one challenge, I think, for this type of cooperation is when we are talking about the people who are in the bottom 5% of the distribution or bottom 10% of the distribution. They have issues related to, they have a resource constraint for traveling. They have the digital connectivity issue that we have been talking about for the last 1 year. So how you will cater the needs for these people? So that is one of the biggest challenge. I think this type of cooperation, especially when we are talking about poorest people, people in the hard to reach areas, how we will cater the needs. So new ideas and new thinking have to be developed in this aspect. So that is one thing. And the third thing I would like to highlight is that in case of the health service delivery, different countries of this region are in the different pace and in a very different pace. So that is also one of the challenge, that in order to bring all of the countries and to have a efficient cooperation, we need to have some common homogeneity across the countries. That is sometimes that is absent. So how to deal with that challenge? So these challenges, I would say, it would be the recommendations and the ideas are very interesting. If you can think about how to deal with these challenges, that would be more motivating for the readers. For the second paper, the paper was on education, and very exciting paper. It's a very interesting thing, especially for academics who are teaching in the universities and higher education. One issue is like when we are talking about this digital divide, we must, and you are talking about a specific university. So I would say that obviously for the policy purpose, it would be very interesting what we can learn from a national perspective for the Sri Lankan perspective, or for the perspective of the whole region. Especially if you or at least think about the Sri Lanka, then one issue is like there can be, because you are talking about 160 students, arts faculty in Sri Lanka, in one of the Sri Lankan universities. So there are some descriptives, but I think I would be interested to see a descriptive of the how it compares to the overall Sri Lankan perspective, because we know that there can be a serious sample selection bias here, because this is only 160 students. So how this student represents the whole population of University of Peradeniya and Sri Lanka, that would be an interesting thing. And if you can see some similarities, that would give a very important insight in terms of the policy prescription. So that is the way you must think to make your paper stronger. Secondly, there are some points that I have found in the descriptives, like females are 74%. So I was just thinking like whether that was that is generally not very common. So whether that was a sample issue, or that is the case situation of the University of Peradeniya. And I would be interested to know about the background, family background and socio-economic background of the students. I think that is very important, because we are talking about digital divide. So whether they are residential student, non-residential student, which part of the income distribution they are coming, these are very important things. How is the situation of the parental occupation? So if you can get some information about this, that would make the story very exciting. And the third point regarding the methodology, I would say that whether you have used the, because when you're talking about the ranking, often the thing is like you tend to bias to the middle section of the rack, like not very good, not very bad. So that is something like there are some techniques to check on this issue. So you can work on these issues. And I was not very sure whether you use the Likert scale, like this type of rankings based analysis. So there are some advanced techniques that you can use, and that would be very interesting for the paper. And you can also try some cross tabs, like across gender, across different subjects, across different income areas, like who are facing which type of trouble, why they are facing, because there are a lot of interesting issues that you can get from already the sample that you have collected. So those would be my suggestion. For the third paper, I would say that 2 points. One is the structure, that the way you have structured, because you have talked about like 3-4 type of categories of students and the issues that you are facing and their perception. I would say that if you can start from something more general, like the general points that you have got from your analysis, start with that those points. Then for some specific groups, whether there has been some differences, if you can highlight those differences, that story that will motivate the readers more in a better way. I think that would be more interesting. And the second point is, like, I think there should be some tables, because I was not very sure that the samples or the data or the with the Google form, how many people, how many CA people you have got information. So these are some issues I think it is very important, because some tabular analysis that always gives a better perception of the whole picture, and some country comparison would be interesting as well. And also you can take some primary data analysis, because in SANIM we just completed a study on with more than 5,500 household, and we have got very exciting information on the primary education and the secondary education, tertiary education students, the problems that they are facing. So you can combine these aspects as well to get better insights. So these are the some basic comments that I want to make, and if I have I don't know how many minutes I have.
Dear discussant, you have 1 minute left.
Okay, so I will just wrap up here.
Not too many, because we only have 10 minutes left.
Okay, just I will wrap up with a few points. One is, like, I think our focus should be on 3 areas. One is increasing the budgetary allocation in health and education. Secondly, to deal with the institutional challenges and the service delivery. Thirdly, in terms of the education, the employment generation challenges. For the first two, I think important is to generate the service delivery. And for the third point, because that is more close to my heart, which is the employment generation challenge, I think the focus, we already have 2 issues in hand. One is the COVID related challenges, and the second issue is we are already facing the challenge of 4th industrial revolution and automation related challenges. So if we can combine these challenges, then the need is, like, for both from the demand side and the supply side, we need to work. For the supply side, we need to upskill and reskill the employer, and we need to prepare the students to cater the needs for the changed globalized environment, change production process that we are facing. And when we are talking about the demand side, we need to think about newer job creation opportunities, especially I would say at this point on a small scale level, so that we can cater the needs for the local demand and the demand from the other countries, other member countries as well. So I think I will stop here. Thank you so much.
All right, thank you very much for these very insightful comments. Many of these I have actually also wanted to talk about myself, but I'm not going to be repeating you because I think the paper authors have probably taken a good note of your comments. I think for the health paper, I fully agree with you that a stronger motivation needs to be found, but also in terms of not only the aspects that you were given, but also maybe a more explicit emphasis on the division between the ordinary health provision and emergency health issues. And so I think particularly in terms of cooperation, the emergency health issue, like pandemics or disasters, etc., would require more attention in this paper. And then perhaps also, the approach in terms of solving cooperation through the services provision and GATS agreement is probably not the best. And hopefully more attention should be given over there. I think lots of questions that we have received through the chat were pointed towards also Professor Sayema, what you teased out, which is the somewhat a lack of attention to socioeconomic aspects of the sampling, and looking into how these factors related to the income distribution and the background in terms of the people included in the sample may affect the results of the research. So I think the author should be advised to look into that and to factor that into their enhancement of the work, as well as you were pointing very well, very correctly, in terms of broadening the base and the sort of anomalies that you pointed with respect to the bias in sampling, also caught my eye in terms of not only gender representation but also subject representation, because the aptitude and the results in terms of the art study may be very, very different from engineering or medical or dental, etc. So we can't really generalize much based on a narrow approach, and in particular when it comes to where do we go from that country level to the sub-regional cooperation or mechanisms that can enhance quality of education. I particularly like your mention of relevance of linking it to the job creation, and here I think the investigation needs to bring much more of the private sector involvement as well, because they are the ones that create the jobs, and so it would be very interesting to see whether they find the job seekers or new recruits of the same quality of education after going through the e-learning periods as those as they had in a conventional education. So many questions still remain to be tackled through these papers. I think both Professor Sayema and myself will be working with the authors a little bit more as well. But there was, before I give a floor back to the authors for 1 minute each, there was an interesting question in terms of health as well, and whether regional cooperation would actually negatively or positively impact the future brain drain, and whether it will improve the quality of supply of doctors, or at least the way they work. So maybe Ms. Datta, sorry, in your reply you can take into account that question as well. And then all of you, when making your last points, can you please look into these questions that relate to socioeconomic issues with sampling and with sort of motivating or directing your research. So with that, let me give the last words to the presenters in the same order, and then we will. Please go ahead. You have to unmute yourself.
Okay, yes.
Is that it?
Thank you. Thank you, Professor Michik, and thank you, Professor Saima, for the wonderful comments that you have given me. First of all, yes, I did motivate, like when I'm writing the paper, I do motivate with a lot of other indicators and service delivery. I do take up the percentage of GDP spent on each on health by each out-of-pocket expenditure, how much is the private expenditure, what is the incidence of HIV, malaria, mental health, maternity health. And yes, of course, Professor Michik's comment on this, that ordinary health and emergency health should be treated separately, and emergency health like COVID should have probably a more cooperative and directed effort for dealing with these. Yes, that point, yes, I should try to figure out how to deal with this. And yes, and the recommendations, of course, yes, the budgetary allocation and your own national health is your first priority before cooperating. And as I said, India has almost increased like 130% of the budgetary allocation to health this year after COVID, because of so much of havoc in the country and so much of deaths. Yeah, yes, digital connectivity, again, from India's perspective, digital connectivity since 2015.
Thank you, Ms. Datta. I think
Okay. Yeah. Okay. I'll
So maybe another 15 seconds.
Dr. Mikic is asking you to kind of wrap up very quickly.
Yeah. Okay. Yeah. So yeah, all the comments are well taken, and I would surely try to improve my paper on those lines. Thank you so much.
Okay, thank you very much. I really apologize for, blame please the organizers for this time squeeze. I'm not the maker of the time rules. Okay, so Miss Mayashi, may I have really less than 1 minute from you? Maybe you just can thank Professor Saima for wonderful comments. Mr. Mayoshi, Mrs. Mayoshi.
So thank you for the comments, and I will improve the research following that comments. Thank you.
Okay, thank you so much. And Ms. Sonamoni, last few seconds from you.
Thank you. One question was asked to me that do you think that your study findings would be different or will be effective?
Please. And
different income statuses were part of your sample with to Miss Fabiha by Miss Fabiha Bushra Khan. I would like to say that one of the goal of my paper was to create the connection of labor market with the students who want to join the workforce, and the recruiters were from banking industry and R&D sectors. So if they want to welcome the workforce, they have to be from the those related sectors, like from the the public universities who have completed their degrees on business and other sectors. We have actually narrowed down our studies, and it did not included medical or engineering students of the country. So yes, it could vary actually if we take take those samples in our studies, but our goal was to solely to establish the establish the relationship to how they actually fit into the paradigm shift when the banking industries and the R&D sectors, or mainly the private industries, actually want to look forward to the future, and what are the mechanisms they want to incorporate, and other things. Those were told by ma'am. The honorable discussant and honorable chair was highly were duly welcomed, and I thank you everyone for this great opportunity again.
Okay, thank you very much. I think with this, because we ran out of time for the session, I would like to really thank also the participants that posed very pertinent questions, and I would encourage the authors to look at these questions very carefully in their revisions of the papers. And so, in summary, the topic health and education is of course an open topic and will require much further work, not only from the point of view of individual countries involved in these, but also in looking at the BIMSTEC and the wider regional cooperation. I think there are elements probably in some in the papers that can be taken further in that regard, while also some of the papers are really mostly focused on the national agenda. So with this, I would like to thank the organizer for giving me this wonderful opportunity to listen to the these wonderful authors of the papers, and I hope we will remain working together in future. So thank you very much, Salim, and I hand back to you. Yeah.
Thank you, Dr. Mia Mikic. Thank you so much, and I must thank 3 paper presenters. I know how difficult it is because during the COVID time, the data is a big issue to get the updated data, but they tried their level best, and thank you so much for that, and also to Dr. Samahak Bidisha for excellent comments. So we had a wonderful session, and I welcome you to the next session, which will start in next couple of minutes. Thank you, Mia, and hope to see you in the other sessions too.
Thank you very much, and stay in touch. Okay, thank you.